Well, have you ever wondered how anesthesiologists manage to put patients to sleep without causing any harm? It's a fascinating dance of science and skill, isn't it? Today, we're going to delve into the world of non-barbiturate induction drugs. These are the silent heroes that play a crucial role in countless medical procedures, from routine surgeries to life-saving operations. They're a key part in the smooth orchestration of anesthetic care, providing a safe and effective way to induce sleep without the risk of serious side effects. So, the next time you ponder over the marvels of modern medicine, remember the unsung role of these remarkable drugs. The answer lies in the power of non-barbiturate induction drugs. Before we delve deeper, it's essential to understand what induction drugs are. Now imagine you're a surgeon preparing for a medical procedure. Your patient is anxious, and you need them to be calm and unconscious for the procedure to run smoothly. This is where induction drugs come into play. Induction drugs, in the simplest terms, are medications used to induce anesthesia, transitioning the patient from a conscious state to an unconscious one. They're the bridge that carries patients safely over the river of anxiety and pain into the land of unconscious tranquility. But it's not just about knocking someone out for a while. These drugs also serve to maintain a stable physiological state, helping to control breathing, heart rate, and blood pressure during the procedure. Now let's talk about a specific group of induction drugs, non-barbiturate induction drugs. If you're thinking, wait a minute, weren't barbiturates the go-to drugs for induction? You're right. But with the advancement of medical science, we've seen the development of alternatives that offer similar benefits with fewer risks. Non-barbiturate induction drugs are a subset of induction drugs designed to offer a safer alternative to their barbiturate counterparts. They work in a similar manner, depressing the central nervous system to induce a state of unconsciousness. However, they are less likely to cause severe side effects such as respiratory depression, a condition where the amount of air or oxygen in the body is dangerously low. These drugs are commonly used in a variety of medical procedures, ranging from minor surgeries to major operations. They offer a rapid onset of action, which means they work quickly to put patients at ease, and they have a relatively short duration of effect, which allows for faster recovery times post-procedure. So, non-barbiturate induction drugs are essentially a safer alternative to conventional induction drugs. They provide the essential bridge to unconsciousness, but with a structure that's designed to minimize potential risks, offering a smoother and safer journey for patients undergoing medical procedures. Now, you might be wondering what makes non-barbiturate induction drug special. Well, let's delve into the world of pharmacology to understand this. Non-barbiturate induction drugs have been gaining popularity over their barbiturate counterparts for a number of significant reasons. Firstly, they offer a superior safety profile. While both barbiturates and non-barbiturates can be used for induction of anesthesia, non-barbiturates are generally considered safer. They have a wider therapeutic index, which is the range between the effective dose and the potentially toxic dose. This means that they allow for a larger margin of error, reducing the risk of overdose. Secondly, non-barbiturate induction drugs are known for their fewer side effects. With barbiturates, there's a potential for a host of unpleasant side effects like respiratory depression, hypotension, and even allergic reactions. On the other hand, non-barbiturates have been found to cause fewer of these issues. They're less likely to depress the respiratory system or cause a drop in blood pressure, making them a more comfortable option for patients. Now let's talk about recovery times. They're considerably faster with non-barbiturates. Patients who receive these drugs typically regain consciousness more rapidly after surgery, which means shorter stays in the recovery room. This not only enhances the patient's comfort, but also increases the efficiency of hospital operations. But what's truly impressive is how non-barbiturate induction drugs work. They have a unique mechanism of action that allows them to provide anesthesia without the heavy sedative effects of barbiturates. This makes them incredibly versatile, suitable for a wide range of surgical procedures. In summary, non-barbiturate induction drugs offer a safer, more comfortable anesthesia experience with fewer side effects and quicker recovery times compared to barbiturates. They have revolutionized the way we approach anesthesia, providing a more patient-friendly alternative that prioritizes safety and comfort. Clearly, non-barbiturate induction drugs are a game-changer in the world of anesthesiology. Let's take a closer look at how these drugs work. Non-barbiturate induction drugs are fascinating in their mechanism of action. They act on the central nervous system, specifically on the brain, to induce a sleep-like state or anesthesia. But how do they do this? Well, the answer lies in their interaction with certain receptors in the brain. Imagine the brain as a bustling city with neurons as inhabitants. The neurons communicate with each other using chemical messengers or neurotransmitters. There are two main types of neurotransmitters: excitatory, which stimulate the neurons, and inhibitory, which calm them down. The balance between these two types ensures the smooth functioning of the brain. Now, let's introduce our non-barbiturate induction drugs into this city. These drugs act like an inhibitory neurotransmitter called gamma-aminobutyric acid, or GABA for short. GABA is the brain's main inhibitory neurotransmitter, and it works by reducing the activity of neurons. When GABA binds to its receptors on the neuron, it opens a channel that allows negatively charged chloride ions to flow into the neuron. This makes the neuron less likely to fire, thereby calming down the brain's activity. Here's where the non-barbiturate induction drugs come into play. They enhance the action of GABA. They bind to a specific site on the GABA receptor, distinct from where GABA itself binds. When the drug binds to its site, it makes the GABA receptor more responsive to GABA. This means that more chloride ions flow into the neuron, further reducing its activity. So in essence, non-barbiturate induction drugs are like the city's peacekeepers. They enhance the calming effect of GABA, reducing the brain's activity and inducing a state of anesthesia. It's important to note that these drugs don't work alone. They are usually used in combination with other drugs, such as opioids and muscle relaxants, to ensure a smooth and safe induction of anesthesia. The opioids provide additional pain relief, while the muscle relaxants prevent any unwanted movement during surgery. One of the key advantages of non-barbiturate induction drugs is their safety profile. They have a high therapeutic index, meaning there's a large difference between the dose that's effective and the dose that's harmful. This makes them a preferred choice for inducing anesthesia in a variety of patients, including those with cardiovascular disease. But like all drugs, non-barbiturate induction drugs are not without their side effects. These can include nausea, vomiting, and changes in blood pressure. However, with careful monitoring and management, these side effects can be minimized. So it's a complex process, but the end result is a safe and controlled induction of anesthesia. So what are some of the most commonly used non-barbiturate induction drugs? Now that's a question that piques interest. Let's start with propofol. This drug is a shining star in the world of anesthesia, often considered the go-to induction agent in many surgical procedures. It's known for its rapid onset and short duration of action, which makes it highly desirable. Propofol causes anesthesia in mere moments, and patients wake up quickly once the infusion is stopped. This allows for precise control over the level of anesthesia, which is a significant advantage in surgeries where time is of the essence. Plus, it has antiemetic properties, which means it can reduce post-operative nausea and vomiting. Quite impressive, isn't it? Next up, we have etomidate. This drug is not as widely used as propofol, but it has its unique strengths. The real advantage of etomidate is its cardiovascular stability. This means it doesn't significantly lower blood pressure or slow the heart rate, making it a preferred choice for patients with compromised cardiovascular systems. It's like the reliable friend you call when you need a steady hand, providing a safe and stable anesthetic experience. And then there's ketamine. This one's a bit of a wild card. It's a dissociative anesthetic, which means it works in a slightly different way. Instead of causing a traditional sleep-like state, ketamine creates a trance-like state where the patient is disconnected from their environment. This can be particularly useful in certain situations, such as in emergency medicine or in patients with severe trauma. Plus, it has powerful analgesic properties, meaning it can provide pain relief in addition to anesthesia. It's like a multitasker, juggling different roles with ease. But let's not forget about the potential drawbacks. Like all drugs, these non-barbiturate induction agents come with their share of side effects. Propofol, for instance, can cause a drop in blood pressure, while etomidate may suppress adrenal function. Ketamine, on the other hand, can cause hallucinations and other psychological effects. It's a delicate balance, weighing the benefits against the potential risks. But that's where the art of medicine comes in, making these decisions in the best interest of each patient. So there you have it. 3 of the most commonly used non-barbiturate induction drugs, each with its unique uses and advantages, each playing a crucial role in the field of anesthesiology. They're like the leading actors in a blockbuster movie, each bringing their unique talent to the table, working together to create a successful outcome. And while we've only scratched the surface, hopefully, this gives you a better understanding of the critical role these drugs play in modern medicine. They're not just chemicals in a vial, they're tools that help surgeons perform life-saving procedures, that help patients endure what might otherwise be unbearable. These drugs are the heroes of modern anesthesiology. What does the future hold for non-barbiturate induction drugs? As we peer into the crystal ball of pharmacology, we see a landscape brimming with potential. Ongoing research and development are continually shaping the future of non-barbiturate induction drugs, promising new horizons in the field of anesthesia. One such area of focus is the development of new molecules with enhanced safety profiles. Scientists are tirelessly working on creating drugs that not only act swiftly, but also have fewer side effects. These next-generation anesthetics could potentially reduce the risk of postoperative cognitive dysfunction, a common concern with current anesthesia drugs. Moreover, the future might hold personalized anesthesia. Imagine a world where your anesthetic is tailored to your genetic makeup, minimizing the risk of adverse reactions and enhancing recovery times. This concept, known as pharmacodynamics, is not far from reality. Researchers are delving into the human genome, seeking to understand how our genetic makeup can influence the way we respond to drugs. Another fascinating development in the pipeline is the use of artificial intelligence in anesthesia. AI has the potential to predict a patient's response to anesthetic drugs, improving safety and outcomes. It could help anesthesiologists in making informed decisions about the type and dosage of drugs to administer. The future also holds promise for the environment. Yes, you heard it right. There's ongoing research on developing environmentally friendly anesthetics. Many of the current anesthetic gases are potent greenhouse gases. So, scientists are working on creating alternatives that are not only safe for patients, but also gentle on our planet. Moreover, the advent of new drug delivery systems, such as nanotechnology, could revolutionize the way anesthetics are administered. These systems could potentially offer precise control over drug release, improving the effectiveness and safety of anesthesia. In conclusion, the future of non-barbiturate induction drugs is a thrilling journey of discovery and innovation. It's a journey that promises to deliver safer, more effective, personalized, and eco-friendly anesthesia solutions. With continuous research and development, the future of non-barbiturate induction drugs looks promising. So, we've taken a journey through the world of non-barbiturate induction drugs. From the outset, we got our hands dirty with the basics, understanding the nitty-gritty of non-barbiturate drugs. We delved into the definition, exploring these powerful agents that induce anesthesia without the use of barbiturates. Next, we discussed the advantages of these drugs. We discovered that they offer a safer, more reliable route to unconsciousness with fewer side effects and quicker recovery times. This marked a significant advancement in the realm of anesthesia. The journey led us to the mechanism of action of these drugs. We learned how they work on the central nervous system, altering the electrochemical balance to induce a state of unconsciousness. We then met some of the star players in the non-barbiturate world. Drugs like propofol and etomidate, which have become the go-to choices for many anesthesiologists. Finally, we looked to the future, envisioning the potential of these drugs in advancing anesthesia. The possibilities are endless, from refining the current drugs to developing new ones that are even safer and more effective. Next time you hear about induction drugs, you'll know exactly what's happening. Until then, keep learning and stay curious.